For me, I think the biggest thing that gets overlooked in a lot of patients and in a lot of clinics is just setting the body up to be able to manage inflammation on its own. And one of the biggest ways that we do this is actually through our redox potential, which is mainly determined by levels of glutathione, vitamin E, and vitamin C. Now, most of the time, vitamin E levels, we don't really need to supplement with those as much as we do with vitamin C and glutathione. And there's actually a lot of research showing that if you just give the cofactors for glutathione production and recycling, which is going to be like vitamin C is actually one of them, vitamin C, magnesium, zinc, and B5 or pantothene. If you give those, you actually get a really robust increase in intracellular glutathione levels. And so I think the biggest things that we've been working with recently is just straight up simple magnesium, vitamin C, and then just B vitamins all around. Because if you look at the data on wound healing, if people are not compromised in any way, meaning they have no cardiometabolic disease, they have no other comorbidities, whether it's immune function, autoimmune disease, if they have nothing, right? So someone like you, for example, if you came in, you're like, hey, let's do some PRP on my shoulder, my knee, whatever, it would be like, okay, let's do this, and then let's just add in something that is going to help you in the post-recovery phase to optimize that better. So there might be some vitamin C, zinc, some collagen, that type of stuff. But overall, you're probably not the person who we would really need to spend a lot of time and a lot of money on optimizing because you're already healthy. You got a 50-year-old guy come in who's 60 pounds overweight, he's insulin resistant, he's got hypertension, he's on 3 or 4 different medications. That's the type of person that we want to stop and say, I know that you're really excited about this PRP or this bone marrow concentrator adipose cellular therapy, but we need to pause for a second because your tanks, your reserves of these vitamins are really, really low. And so we need to spend the time to work on them. And so for most patients, that's going to be vitamin C, magnesium, B vitamins with a heavy emphasis on B6 or P5P, and the B5, which is our pantothene or pantothenate, and then fish oils as well. Those are kind of the big needle movers that we see clinically that will make a big difference, not just in their ability to heal, but just in their body's ability to handle the inflammation that's going on. So most of the patients, when we do this stuff for 4 to 6 weeks before stem cell procedure, they're already getting better. And we haven't even done a procedure, right? And then we do the procedure and then they're better set up to have a better response and their body's able to continue to heal just from the oral and sometimes intravenous things that we're doing beforehand.